All right, we are on. Welcome everybody to this week's episode of Weekly Dose. I am super excited today. We're going to be talking all about allergy shots. I have an amazing doctor here with me, Dr. Dapul. So we are going to get into it in just a moment. So I'm going to start with introductions. So for those that don't know me, my name is Dr. Ude. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine. And my goal is to have my patients not only looking good, but feeling good. So, Dr. DePaul, I'm actually going to have you introduce yourself because I don't think I'm going to do it justice, and then we'll get right to okay.
Okay, sounds great. Thank you so much, Dr. Ude, for having me and inviting me to be a guest on your podcast. Again, my name is Dr. Gina Dapul-Hidalgo, but I go by Dr. Dapul, and I am a board certified pediatric and adult allergist and immunologist in the Washington, D.C. area, namely Montgomery County, Maryland, in the Gaithersburg, Rockville section of the town. So yes, I take care of both kids and adults with allergies, asthma, food allergies, eczema, hives, all the whole gamut. And my goal here is to serve my local community with the best patient care that we can give the patients who are my neighbors and my friends.
Oh, that is awesome. Well, I didn't realize you were that close. Like I'm in Martinsburg. That's hours. So
Mm-hmm.
great. Guys, we're gonna get started. So allergy shots. So Dr. DePaul, from your perspective, what are allergy shots?
Yes, so this is a very interesting treatment that, not many people know about, but it's been out for over a century. So for over 100 years, we have been, using this. And the idea behind it is that we actually give you what you're allergic to. So things like pollen, dust mite, cat, dog, mold. And we put it into these little vials to treat your allergy and your asthma symptoms. So it's giving you increasing doses of this every week or every couple weeks. And then once you get to what we call the maintenance dose, so we build it up and then you get to this top dose, then you usually come back every 2 to 4 weeks. And this really is a long-term treatment for patients who have allergies, what we call seasonal or year-round allergic rhinitis, as well as those who have asthma. And for those patients who actually have very severe bee sting allergy, we also give this for venom immunotherapy.
That's pretty cool. So what qualifies somebody to get an allergy shot? Like what's that process of
Okay, so great. So this is exactly what we do on a daily basis in our office. And so once patients are referred to us or they come find us, the idea is we want to find out what you're allergic to. So these are patients who, will have these itchy eyes, watery, swollen eyes, coughing, shortness of breath, stuffy, runny nose. And with the upcoming pollen season, this is when we see the seasonal allergies take place. But there are some patients who actually have these symptoms year round. And those can be from indoor allergens like dust mites, or if you have pets like cats or dogs, or year-round allergens like mold, which are both indoor and outdoor. So the patients who this would be appropriate for are for those who have allergic rhinitis, again, or what we call allergies, whether it's seasonal or year-round, as well as those who have asthma. So for some patients who might not know what that is, although you had a great podcast with Dr. Ferry on, a couple months ago, this is, if you think about it, your nose is connected to your lungs. So this is where we have what we call inflammation. So there is some things happening in your nose and in your lungs. And allergic rhinitis is when this inflammation is from your neck up. So it's from your nose, your sinuses, and then you get all these symptoms that we talked about with the stuffy, runny nose, postnasal drip, itchy, watery eyes. But if the inflammation is from your neck below, that's where we call it asthma. So for many patients, some people actually have both allergic rhinitis and asthma, or the asthma with the allergic rhinitis, so they can come together because it's called a unified airway, meaning it's one pipe and they're all connected to each other.
Wow. So I'm curious, are there any complications from getting the shots?
Oh, so some of the side effects can be, if you think about it, we are giving you what you're allergic to, right? So the pollen, the dust mite, the mold, but we do it in a safe way. Again, as long as you tolerated the last dose, we keep going up. But some of the main side effects can be what we call a large local reaction. So you'll get at the site of your shot, right over here on your arm, and the fat part of it might get a little red, itchy spot. Typically, it should last just a couple hours, but for some patients, if it lasts a few days, that's when it's worth talking to your allergist and letting them know, because then we might have to decrease the dose and go up slowly or something like that. So that's one of the main things. It's called large local reactions. However, again, because we're giving you these allergens, there is the rare possibility that you actually have a systemic reaction or a more severe reaction, what we call anaphylaxis. So that is when you can have anything from hives, trouble breathing, coughing, shortness of breath, swelling, feeling like you're going to pass out. So we want to be very mindful if you have those types of reactions, for sure. You'll be treated in the office, and then you can speak with your allergist about how to move forward. But the reason, it's a great question in terms of side effects, Dr. Ude. One of the things that we do is we actually watch patients for about a half hour after they get their allergy shots, because that's when the risk is greatest. So most allergist office will say, okay, you get your shot, and then we wait and observe for a half hour. And if all is good, then you're good to go. So those are the precautions that we take in order to do this safely.
That is awesome. Okay, thank you so much for clarifying. So the other thing is, so if someone comes to your office to get the allergy shots, can you kind of walk through what they expect?
Yes, yes. So actually, before we even go to that, we actually need to do what's called skin testing. And so this is where, most allergists will say, hold any antihistamines. So it's things like your Claritin, Zyrtec, Allegra, Benadryl. So we ask patients to hold that anywhere from 5 to 7 days before you come see us. And then we do a little scratch test to see, well, what are you allergic to that might be causing these symptoms? So we'll put on some liquid on these little plastic things. And depending on the practice, we either do this on your forearms or on your back. And then we wait 15 minutes to see what those reactions are. And so based on that, then we can put those allergens into your serum, because if your history suggests that, oh, when you are, outside during pollen season and you're allergic to these tree pollen or grass pollen, those are clinically correlated, meaning it likely is related to why you have your symptoms. And then based on that, we'll put that in your personalized allergy shot vials.
Good to know. Good to know. So if someone out there is listening to this and, considering getting an allergy, what tip or what would you tell them?
Okay, this is great, 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 great questions. So really what I would say is, number one, definitely see your allergist so that you can get testing done, because the other options, you want to know your alternatives, which are to take over the counter or some prescription medications, right? So you might have tried some antihistamines, some nose sprays, some eye drops, but the difference is, and it's important to keep this in mind, is that those medications will treat the symptoms. So you might feel a little bit better, but if you stop taking it or you forget to take it, your symptoms are back. What allergy shots do, or allergen immunotherapy, is it actually provides long-lasting relief by training your immune system to react differently when you encounter those allergens in real life. So it's a way to say, oh, I won't overreact, because really what allergies are is when your body is overreacting to a harmless substance that's in the environment. So the shots will say, oh, I won't overreact to it. So that way you won't have some severe symptoms, and you can actually even decrease the amount of medications that you take. So to answer your question, Dr. Ude, in terms of tips, well, it is pollen season upon us, probably in most parts of the country. So my main tip here for our tree, grass, and weed pollen that are already in the air are to keep your windows closed. Use air conditioning at home and in your car. And if you have been outside for long periods of time, kids are in their sports, if we take walks outside, come home and take a shower. Wash off all of that pollen from your hair, your clothes, your skin, your face. Otherwise, you'll be sleeping with that overnight, and that can contribute to some worsening symptoms when you wake up in the morning.
Thank you so much, Dr. Dapul. That is, I'm pretty sure they're like, oh my God, this was. So I'm going to switch to ask questions about you. So one of the questions I always ask is, why do what you do, Doc. So I'm going to pose that to you. Why what you do?
So actually, it's very personal because I love to treat patients who have the same conditions that I do.
Oh,
And so to serve the people who I know how it feels to have allergies, to have asthma, to have eczema, it is such an honor and a privilege to be able to care for patients and know that I can make a difference with their quality of life, help them feel better, feel confident, and really live the best life that we can.
wow. So you really know the treatment physician side, and you also know the patient things.
Yes, yes.
Okay. The next one, which is kind of an out of the box question, I always ask, uh, if you got a chance to meet your 20-year-old self and you could advise them on anything or tell them something, what would you say?
So I would tell my 20-year-old, Gina, to keep going. And it's okay to make mistakes because these mistakes are things you're going to learn from. And any experience you have will make you stronger and just make you more wiser. So that if you don't go through that, if life is easy, you're not going to know how to keep going because life can be challenging. So the idea is keep going, don't give up, and really reach for your goals. So even if it doesn't seem possible to my 20-year-old self that I could get into med school and, get into allergy and now practice and serve my community, all
Absolutely.
of this is something that, if you keep going, you'll get there. And so don't give up.
Beautiful, because you're already on that side where you've achieved all of it. So I always there could be somebody listening that would, and so thank you so much for saying that. So the other thing I definitely don't want to forget to ask, how find if they're looking to in or look.
Oh, yes, yes, no, happy to serve patients who may need us. So again, my name is Dr. Gina Dapul-Hidalgo, and I go by Dr. Dapul. Our website is dapulallergy.com. That's DAPULALLERGY.com. And you can find me on Instagram and Facebook at Dr. Dapul. That's DRDAPUL.allergy.
Gotcha. Thank you so much. So good. Thank you. So,
Yes, no, it's a pleasure. Thank you, Dr. Ude, for having me.
yes, this was so fun. So, guys, if you have any allergy concerns, and in that realm, definitely look up people. On the flip side, if you're looking for a quality family medicine physician, look us up at Apple Valley Family Medicine. Our website is www.applevalleyfamilymed.com, and our phone number here is 304-350-1087. So you guys have an amazing week, and Dr. DePaul, have an awesome day. Thank you so much.
Yes, you as well. Thank you, Dr. Uday.